And joining us now to talk about your health is Dr. Khanjan Nagarsheth, a vascular surgeon at the University of Maryland Medical Center and professor of surgery at the University of Maryland School of Medicine. Doctor, thank you for joining us. President Trump was diagnosed recently with something called chronic venous insufficiency. The news coverage would show pictures of what appear to be swollen ankles. What is that condition?
Thanks for the question. Thanks for inviting me. So chronic venous insufficiency affects one half of the circulatory system in our body. Our body has blood vessels from the heart and back to the heart. The veins bring blood back to the heart. Venous insufficiency indicates that the veins of the leg are not functioning properly. The blood is not coming back to the heart the way it's supposed to. Sometimes it falls backwards and pools in the legs, leading to swelling, discoloration, or even things like varicose veins.
Can it be riskier than that? Can it cause a clot?
Doesn't typically cause a clot, but it can be resultant from a clot. If you've had a clot before, you can get chronic venous insufficiency.
How does somebody know they have this condition? What are the symptoms?
So oftentimes it's going to affect people that have been on their feet or prolonged sitting for a good part of their life. About 40 to 50% of the people over the age of 50 get it. You're going to find things like swelling of the legs, sometimes fatigue and heaviness at the end of the day, itching, sometimes discoloration of the skin at the ankles and the feet.
Is it related to varicose veins?
So it goes on a spectrum from people having no symptoms at all the way to having open sores and ulcers around the ankles. Varicose veins are in the middle of that spectrum, so it does occur in people with varicose veins.
What can you do for somebody with this condition? What's the range of treatments?
So the range of treatments oftentimes starts with conservative measures, something like elevating your legs at the end of the day when you come home if they're swollen. Keeping your legs above the level of your heart when you're in your recliner helps decrease the swelling. Other things like wearing compression stockings, getting evaluated and getting the proper prescription stockings helps a lot. And then there are minimally invasive procedures to close off veins that aren't working properly, or repairing the valves that aren't working properly, or even removing some of these varicose veins that can be unsightly.
I was just on a long flight, where person opposite me was doing those leg exercises a lot of the time, sort of, flexing, moving the feet up and down. And I think that's about preventing, this is a young person, so I don't know why they would be concerned about clots, but maybe. Is that related at all?
So venous disease or disease of the veins goes on a bunch of different spectrums. It can affect the superficial veins, which is chronic venous insufficiency, or it can affect the deep veins, which is where we worry about blood clots forming and going to the heart and lungs. So those exercises that we're doing was probably to increase the circulation throughout their legs to keep the blood pumping, because as we walk normally, we're pumping the blood with our calves. When you're sitting down for a long period of time, your blood is somewhat stagnant. So sometimes getting up in the aisle and walking during the flight, if it's a long flight, or just pumping your calves at your seat helps.
Really? So, I mean, did nature intend that, do you think? I mean, so if we didn't have calf muscles, the blood would tend to sit there for more people.
Absolutely. If you didn't have calf muscles, the blood would pool and your legs would get swollen, and you'd be more prone to getting blood clots.
So we should all go for a walk.
I think that's really important.
What's the cutting edge of therapy here? What's new? What's coming?
So there's a lot of things that are up and coming on this. There's new technology that helps to reconstruct the valve. So a lot of the times, these valves that are in these blood vessels are not working properly, which forces the blood backwards instead of forward towards the heart. So now we're coming up with minimally invasive therapies where we can actually reconstruct these valves with a stent. Other things like stents for narrowings in the blood vessels or treating clots that have formed, they're all coming out, and very traditional treatments like removing the veins also exist.
What happens to your blood if you take the vein out?
So the body always finds a way. You have millions of veins in your body, and we're only removing the ones that are not working properly.
And the other ones can absorb the...
They take up the slack.
Can they grow?
They do grow, and so sometimes when they grow in an unusual pattern, they can form things like varicose veins. These are the dilation of the veins that we're trying to avoid.
Lifestyle changes for this issue. What works?
Being an active person, walking a lot. A lot of us can stand to lose a little bit of weight. That helps. And then wearing compression if you've been on your feet a lot.
How do you test? I mean, some of it you can just see. I've heard there's another medical condition I've heard referred to as a waiting room disease. The idea was the doctor could look out in the waiting room and say that person has it.
Right.
Is this one of those?
Sometimes. With the right person who's trained in the right way, you can identify this. A lot of times people think they just have things like arthritis and they get swelling because of arthritis. Sometimes that's the case. Oftentimes it's this vein disease that's kind of hiding under the surface. So getting seen by a vascular specialist is very important, and just being proactive about your health.
Is there anything primary care can do for this?
Absolutely. So seeing your primary care doctor if anything's changed, if you're getting more swelling, if you're getting more discoloration, talking to your PCP about this is a great idea, and they'll usually be able to direct you in the right way.
Does family history play a role?
100%. So if you have a family history, a lot of times I have patients come to talk to me and tell me that their mothers had varicose veins or their fathers had varicose veins. It does get passed down through generations. And so if you have a family history of it, you're more prone to get it.
Footwear. Is there a type of shoe? You talked about compression socks or stockings. Is there a type of shoe that might help?
Good arch support helps a lot, especially in people as we get older. If you have things like high blood pressure or diabetes, it can lead to problems with the circulatory system throughout your body.
A viewer wants to know, is the exercise of pounding one's feet on the ground repetitively to pump the blood back to the heart good for folks with swollen legs? And you're not talking about just banging your feet on the floor.
Yeah, no. Nothing dramatic or traumatic.
But pounding the pavement,
pounding the
as
pavement
that's
and
understood
walking,
to mean going for a walk.
That's a great way to do it, but just a simple calf pump or a heel lift helps a lot.
Okay. You mentioned leg ulcers.
Yeah.
How's that related?
So that's kind of the end stage of this disease, right? It goes on a spectrum from having nothing at all the way up to having open sores on your ankles and calves. These ulcers become very painful and they're hard to heal, which is why we try to treat this preemptively and before that happens.
You believe you can intercept that if you get to somebody early enough?
Very often. If you get to someone early enough, you can get the right conservative measures and never need a procedure or surgery.
What causes the ulcer? Is that related to, sometimes people have a wound and it heals slowly?
Yeah, that's exactly what we're talking about, is that if your legs are very swollen, our skin heals from the edges. So if you have a cut, it's going to heal from the edges in. And so if your leg is very swollen, that skin is kept open by that swelling, so it prevents the skin from growing together.
If somebody has this, and you've probably talked to patients about this all the time, and doesn't treat it, with exercise or is medication a role? Anyway, if somebody leaves this untreated, is it guaranteed to worsen to the end stage condition?
It's definitely not a guarantee. It progresses in about 20 to 30% of people.
Really? So why do we think?
Most people will stay in the stage they're in. So most people will stay with leg swelling or stay with their varicose veins. Now, if those pains, if the veins become painful, if they develop sores on top of them, or if they bleed, that's a reason to seek treatment additionally. But most of the people will progress if they put on more weight, if they're becoming more inactive, or if they're just doing other things that they shouldn't be doing.
Is it related at all to peripheral nerve issues?
So peripheral nerve issues cause you to not sense that you have these problems going on. So it can.
All right, Dr. Khanjan Nagarsheth is a vascular surgeon at the University of Maryland Medical Center, also professor of surgery at the University of Maryland School of Medicine. Doctor, we appreciate your time.
Thank you very much.